Everybody who I spoke to knew Dr. Mast. When I had talked to Dr. Dillingham, he said, if you ever do decide to get a hip replacement, Mast is the best. I knew that when I was ready, there was only one person I was going to go to. What I really liked about him was that it wasn't that he was just going to get me out of pain. He was going to get me back to the level of activity that I used to be at. Before I had hip pain, I was very active. I was a runner, mountain biking all the time, snowboarding. I used to ski. I tore my ACL skiing 30 years ago. I love to be out in the water. I paddle, I surf. Just, being outdoors in general. I have always had animals, dogs, so we're always outside doing things. I worked out quite a bit, so I had a lot of energy, I had a lot of strength, and I really didn't have any kind of chronic pain. The placement of the pain in the early stages presented like hip flexor pain. So it was right in the front of my pelvis. But what I also found really in one of the very last runs that I did was that the pain wrapped around my leg. So it came from like where that hip flexor area is, wrapped around my leg and down to my foot. I had to stop being the person that I wanted to be because I was in pain. And even in trying to find a way, I didn't even see it in myself that I was limping, I was compensating, I was not doing things that I really would have loved to have done because it hurt too much. There was only one doctor that I was going to go see. His mindset was that, okay, you're an athlete in your mind, I'm going to get you back to that place. It's not just a matter of, you need to be able to walk around a little bit better. Of course, you want to be able to do those things too, but that he had that sort of thinking and his other patients who I spoke to who were very active. So that gave me great comfort to know that I was in good hands. I was really relieved by was that Dr. Mast had said I wouldn't go under general anesthesia, which I know is a recovery unto itself, especially when you're under for several hours. For the surgery itself, I felt I had the best surgeon. I felt very comfortable with Dr. Mast and that he knew what he was doing. He has a great track record. There was no nervousness there. The staff at the hospital were amazing. I was well cared for, well looked after. I think it's very normal and natural to have some concerns about going into surgery. I will tell you, coming out the other side of it, the staff was amazing. The surgery, my recovery was so fast. I mean, my incisions healed so quickly. It was night and day compared to the ACL reconstruction I had 30 years ago. And I don't know what Dr. Mast does in there, but it was a very easy recovery considering how big the surgery is. When I went to see Dr. Mast, he said, now you need them both, because I was having joint pain in both hips. He said, you have an option here. He said he doesn't give this option to everybody. He said, but you need them both done. He said, you can get them both done at the same time. Or you can get one done as an outpatient and 3 months later come back and get the second one done. And if I were you, I would do both. What I have come to encounter, one of the few surgeons who will do bilaterals. I guess I have spoken to other people who have said I hadn't heard, like my doctor wouldn't do two at the same time. If you're a candidate for it, I am so glad that I was able to get the one surgery done. The recovery was really great. My physical therapist, who I was way ahead of the curve for my recovery. I went to 2 different places for physical therapy. They were all really impressed with how well my incisions healed and how much flexibility and mobility, how quickly I got all of that back. When I could pinpoint movement that I knew had been painful for me, and then 8 weeks later I was doing it and the pain was completely gone, that was like, wow, everybody needs to know about this because you don't have to live with this pain. I feel like I'm getting my life back Even now, I just had my 6-month anniversary of my surgery, but I feel like there's pieces of my life, my old life, if you will, that come back where it's like I don't have to give a second thought about walking through the airport. It doesn't matter how far I have to walk, I can do it. Just like I used to be able to do it.